Welcome to the live event, and it's great to welcome so many people who've come before, but also we've got some new people today, so that's fantastic. And I'm Barbara Holding from caninehscourses.com, and we're going to launch a new series, depending on the feedback, on bite-sized canine anatomy. And tonight we're going to look at the muscle Triceps Brachii. So for those who've been before, I'm just going to orientate you, do a bit of housekeeping. And if you're new, the chat box that you can use is down in your right-hand corner where it says, say something nice. And that's for letting me know you can hear me. So if somebody can say they can see the picture, if they can hear me, that would be great as a check-in. And then along the bottom navigation bar, there's ask a question. So if you'd like to ask a question, please do put it in there. Otherwise, it gets lost in the chat as that scrolls up. We haven't got any at the moment, but they're timestamped. So if you ask a question, I can timestamp them and you can go back and listen to that particular section of the webinar later. There's also a poll next to it on the right. So if you click on there, if you'd like to vote on the poll, that would be great as well. When I come to us answering the questions, and I'm really happy to answer any questions that you pose throughout the event, if you can stop uploading them just for that moment, otherwise I lose the question that I'm going to be chatting about. Anyway, it's a great start to the new year. I'm really excited about this, and I'm just going to pull up the slides. I'm hoping I'm going to pull up the slides. Okay, so my slide has frozen. There we go. I think we're there. Can you see the slides on screen? If somebody could just let me know after Caroline's hi from a hot and humid South Africa. So welcome. Thank you. Thank you. That's fantastic. So I'm just going to, as I've explained before, I don't have a tech team. It's just me. So we're just going to pull up the first slide. Hopefully you can see the first slide. And just to think about muscle contractions in skeletal muscles, they provide the force for canine posture and movement. And it's really important to know that we have patterns of movement, and that from these muscle contractions, they're very complex interactions of a whole range of muscles. So no one muscle or a couple of muscles work together. And what we've got is a real difference of how movement is organized in humans compared to dogs. And I'm all about the dogs. So canine natural balance stance, postures and motion predominantly uses rhythmic motor patterns, whereas it's completely the opposite in humans. They mainly use learned motor patterns. Dogs use some of that, that's in their training, but I'm doing this from a perspective of a physiotherapist and a hydrotherapist. So I'm doing it from a therapeutic viewpoint rather than a training point of view, because I want to set up the dog to achieve and get the best optimal results for each session that I use. So just got a little bit of a freeze there. I hope that's come up, the next slide. So let's deep dive into muscle facts. This is what we do know about triceps brachii muscle, and the name of the muscle helps you get orientated. So it's an intrinsic muscle, and what that means is that the origin and the insertion are within the forelimb. They are within the appendicular skeleton. And triceps brachii is a caudal brachial muscle. So it lies in, I hope you can see my hand here, or the arrow. If somebody could just tell me they can see that. It lies in here between the scapula, the humerus, and the olecranon, which is part of the ulnar bone. Is everybody seeing the hand move around, just showing you where the muscle lies? Thank you, Sarah. That's really helpful. Thank you. Another Sarah, fantastic. And the innervation of triceps is the radial nerve, which is the biggest and most important nerve in the brachial plexus for the forelimb, for the thoracic limb. And really important, the reason we started with triceps brachii, it's crucial to natural balance motion and efficient motion. It is an anti-gravity muscle, and it's incredibly important as an anti-gravity muscle. And so because of that, it's actually the key functional muscle of the thoracic limb. So as a therapist, I'm going to be paying it a lot of attention. But what's fascinating is that it's got 4 heads, whereas in human, there's 3 heads. And the 4 heads have slightly different roles in motion. And this is going to give you that underpinning knowledge to help you select the best treatment techniques for the dogs in your professional care. So just going to move that slide on. Maybe not. There we go. So we have to have a look at the innervation and really think about it, because that's what turns the muscle on. So the brachial plexus is formed by the ventral spinal nerves from C6 to T2, and I put that there just because then you can see it's a number, whereas the radial nerve, it arises from those spinal nerves of C7 to T2. So if you look at 62 and 72, it really helps you understand that. And so it's really important for us to also know the root of that nerve. And what it does is it goes through Triceps Brachii. And usually if a nerve goes through a muscle, it innervates it. So that's a good way to remember it's the radial nerve. It then piggybacks the brachialis muscle, which helter-skelters down round the humerus. So we've got, here we go, in here, triceps here, and it helter-skelters round. I've got a top clinical tip for you, and I'm going to scatter them through because I'm doing it from a therapeutic perspective. If you palpate too grossly or press too much just on the caudal border of the lateral head of triceps, the radial nerve is very vulnerable there, and you may get a pain response thinking it's something else, but you're actually impinging the nerve. So that is bumper height. It's very prone to terrible injuries with car bumpers in road traffic accidents. So be really aware that it's very vulnerable to your palpation there. So using therapeutic touch and palpation is so important. And then it passes down here into the extensors of the antebrachium. So it is, good evening, Lisa, welcome. So it is actually the motor innervation of the radial nerve for triceps is the elbow, carpal, and digital extensors. And then it's also got the cutaneous innervation, the craniolateral and the craniomedial aspect of the antebrachium. So brachial, brachii, brachial muscles, and brachium are all from here, because this is the brachium of the dog here. There's your scapula, there's your humerus, and that's the brachium, the arm. The antebrachium is the forelimb. So this bit here is known as the antebrachium, and that will help you organize understanding where all the muscles are, because it usually has something in the name. Let's get to the next slide. So muscle facts. Triceps brachii, as I said, has 4 heads. And there's some really interesting information about the different functions of the different heads working collectively as the main anti-gravity muscle of the forelimb. And it's the most important muscle for you to kind of give attention therapeutically when you're treating the dog, whether you want to enhance movement and improve efficient loading, whether you're rehabilitating, whether you're supporting an elderly dog who's changed their pattern of movement to something more inefficient, so you will know where to target your techniques. So the long head of triceps, it spans 2 joints. So it spans the shoulder joint, which is here, and the elbow joint. And the long head of triceps comes from here. I've got some really good slides next to just show you exactly where it is. And it's the caudal border of the dog's forelimb. And flexion and extension, so it's the main elbow extensor. Flexion and extension are the main movements of canine motion and posture. The accessory movements, or the ancillary movements, are more important in humans than in dogs. So you're looking at your flexors and your extensors, and there are 2 reasons you have 4 legs in the dog, and that's to support you against gravity. So you need some really sound anti-gravity muscles that are working efficiently, and also to accelerate you forwards. So they are designed to go forwards in a straight line, and the sagittal plane is the easiest thing. If they turn, if they break, they're more complex movement patterns. So we're just having a little look at the long head. So some interesting information for you is that the long head has 70% fast twitch type 2A, it has 70% of white muscle fibers, of fast twitch type 2A to type 2X. And what we've got here, it's involved in burst activity. So your long head of triceps is really important for short durations of burst activity of very high force. And that's its key role in locomotion in the dog. Sorry about the mix-up. I've got a little bit of a board here just supporting me, and I got a bit confused there, so it happens to everybody. So then it lies between the long head, is going to be lying caudally, and then we've got the lateral head here, and the lateral head has a very different action. And if you want some great information, please go to an anatomy text like Miller's or Evans, rather than anatomy text within another book about other different things, because you need that depth of detail. So the lateral head is really important as a joint stabilizer. It's active when the limb is actually weight bearing, when it's loading. And it maintains a rigid limb to support the weight against gravity. So this is a really top clinical tip, because this is why therapists need to concentrate and focus on natural balance stance work. And that isn't stopping the dog and it just standing still. That's actually the dog actively going into a natural balance stance, because they will engage their lateral head of triceps. So this is a really exciting thing to be thinking about your program, why you need that natural balance stance posture, and also why you need motion. So we need static work and we need dynamic work. And it's also, the lateral head, really important in dynamic locomotion. So this is a very complex muscle with different parts of it having different functions. Now the medial head, which we can't see obviously because it's on the medial aspect of the limb, the medial head and the accessory head are totally different. So the medial head is largely composed of type 1 red muscle fibers. These are aerobic and fatigue resistance. So as a general rule, muscles that are laterally placed and superficial are very, very important in active movement, dynamic movement. And usually muscles that are placed deep and medially placed are going to have a very strong role in postural muscles and stability. So it's really interesting that the lateral head, even though it's just under the skin, has a really important role for stability of that joint, as well as being important in dynamic motion. And that's going to help you build what you should be putting in your toolbox of your treatment plan for each individual dog. So it's really important, the medial head, in maintaining posture and in a quiet stance. Again, you need to help the dog find its natural balanced stance actively with you. It's not about just stopping and pulling the dog to a stop or just a rest. It's got to be a thoughtful, organized, balanced stance. And then you're going to recruit and switch on those medial and lateral heads of triceps. So this is really top stuff for therapists who are very occupied in improving the movement, quality movement and motion, and improving dogs' lives. So the accessory head, it lies like a jam in a jam sandwich. It lies between the medial and the lateral head, and it's deep. It's really important as a postural muscle. It lays deep to it is anconeus, which is a very small, very important proprioceptively enriched muscle that gives a lot of information about the activity and what the joint is where the elbow is moving. And basically your accessory head lays on top of that, but between the lateral and medial head of triceps. It's got a really significant postural role, has the accessory head. It's really small, and it's got a huge high percentage of type 1 slow muscle fibers. So I think that's really useful for you to think about when you're thinking about your treatment plan, what you're going to do, whether you're working within water in hydrotherapy or whether you're working on land, and if you're integrated, putting the two together so they're really relevant to the dog's needs. So here's the long head. And as you can see, the long head, when you look at in the dissection books, you will see that it looks like it's two pieces. Okay, and it's got a really strong round tendon that attaches here to the caudal olecranon, which is a huge tuber at the top of the ulna. And it attaches, so its origin is here on the caudal border of the scapula. There's your scapula, there's your shoulder joint. So it attaches to the caudal border of the scapula by a fleshy attachment, and also a really strong tendinous attachment as well to the infraglenoid tubercle, just basically that little bump there. Okay, and then that's a closer view of it, just so you can see that arrangement of the muscle. And then laying on top, on the lateral aspect here, we've got our large lateral head, and the lateral head arises from the proximal humerus, whereas the long head attaches to the scapula. So the long head goes over two joints. It has an action of shoulder flexion, and its main action, really important as an anti-gravity muscle, is elbow extension. The lateral head's lying there. It covers one joint, it goes over the elbow, so that is an elbow extensor. They work together, and that the tendons, you can't quite see in the picture there, they kind of conjoin, they converge quite late. Just move to the next slide. Then if we peel away the lateral head, you can see deep to it here, this is the accessory head. And the accessory head is attached to the neck of the humerus. That's the neck, or the caudal part of the proximal part of the humerus bone. And then it's got a long, thin tendon that again converges and joins with the long head, that really important, strong, round tendon, and also with the lateral head tendon. And a really important thing to know is that the dog also has a bursa, and a bursa is a connective tissue sac full of fluid. It's about reducing friction. And the bursa lies deep to the tendon of triceps between the olecranon and the tendon. And that's a useful fact to have at your fingertips. There's also a lot of fatty attachment in that area as well. So going to the next slide, we're just having a look when we're thinking about palpating a muscle. I'm just going to have a quick look. Any questions? Nothing there at the moment. Can you still hear me all right? Anybody voted on the poll? So yes, often. So someone's seeing a lot of triceps brachii muscle injuries. Brilliant, thank you. Thank you for that. Do have a vote on the poll. I'm really interested, because if I've got a lot of people looking at triceps brachii injuries, it's really helpful to understand the different feels when you palpate it clinically. And I can put something together for that if you're interested as well. So I'm just really relying on your feedback to kind of know, to be directed where you'd like me to go with this. So therapeutic touch is utilized for assessment techniques. Why do we want it to use that rather than just gross palpation? Well, that's because therapeutic touch is about a two-way communication. So therapeutic touch is part of movement enrichment techniques, and canine movement enrichment techniques consist of therapeutic handling techniques and clinic enrichment techniques. And I'm particularly looking at the therapeutic handling techniques because we want accurate assessment of the muscles. And the reason this is really important is because we know that muscles respond to the emotional state of the dog, and that it influences the muscle tone. And the dogs respond behaviorally when you're palpating, and they use very subtle facial expressions. There's rising of their hair, their tail might be wagging, they might bark, and they have a whole range of body postures in your clinical setting that's giving you really useful information. And what we're trying to do with therapeutic handling is we're trying to build a professional bond so the dog will work actively in an engaged, alert, and focused way. And then by palpating the muscles when they're in that state, rather than in shutdown or stoic or in pain and trying to move away from you or not cooperating with you in that setting, we're going to be able to get some really accurate information to interpret what's going in a whole range of muscles. We're not just going to focus on one, we're going to look at the dog holistically, but within the muscle is the story of what that muscle's going through. So we're going to be responsive to the dog's feedback in real time because they're giving signals out continually in the clinic, and we're going to use therapeutic handling to get the very best information so we can get that treatment plan to fit the needs of each dog. So here we go. This is just showing the lateral head here on this lovely little dog here. And I'm just palpating the lateral head. And I've got another top clinical tip. You need to think about the posture that you're palpating the dog in. So ideally, you want to be able to palpate your triceps brachii here. You want to be able to palpate it in a range of postures, in lying, sitting, Taking the opportunity, not putting the dog into that posture, but taking the opportunity of the postures the dog takes and in standing. And the reason for that is that the muscle has a whole arrangement of fascia around the different heads, between it and around it. And you're going to have different fascial tension, which will give you different information. Another really good top tip is that's my thumb, and that's how high the long head is. It's right at the caudal border of the scapula there. Is that the fascial guttering, I don't think you can see it, but it's just there between the long head and the lateral head. So I'm just going to go back a couple of slides just to show you this. So this fascial guttering here, you will feel it. The fascia is like an envelope around a very important letter that provides force. That's a very common site for trigger points and is a very common site for injuries. And the long head of triceps, that's the most commonly part of triceps that's injured because it goes over 2 joints. So we know the facts are that you've got the strongest pull, the strongest force at your origin and insertion. So here you have a huge force production and here. And because it goes over 2 joints, muscles that pass over 2 joints are much more susceptible to getting injured than muscles that pass over 1 joint. So some really good clinical tips here to help you find your way around this muscle, depending on the dog's conformation, signalment. It's going to be really different on each dog. So the last tip that I want to go through, because it's a bite-sized presentation and we want to do lots of these, hopefully I'm staying to time, is a really important one when you're doing your therapeutic fit of the Y-shaped harness you've selected. Just like you may have a variety of shoes and they all fit you slightly differently, definitely harnesses, you've got to find the best fit for each dog because there's so much difference between the breeds and within a breed. And so the most important thing is when you're doing your harness fit, you do not want that strap too far forward because there is the long head of triceps, the caudal border of the brachium. And you do not want that to impinge onto that muscle, which is such an important anti-gravity muscle, and all the different heads work slightly differently but cohesively together. So I hope you found that interesting. Are there any questions? Having a little look. No questions on this one, but that's great. If you want to know any more information, I've got a great announcement, which is really, really exciting to let you know about. If you go to, I'm just going to put a link. Hopefully you can see that. If you go to the website caninehscourses.com, we have launched our learning tracks. We open them to the people who have subscribed to us early, and now they're open to everyone. So if you go along the navigation bar at the top of the website and click on resources, there'll be a drop-down menu, and we've opened 3. So if you want to know more about movement enrichment techniques, please have a click on that. It's got an interactive, informative blog linked to a crowdcast. Thank you, Kate. Thank you for the feedback, because I'm really depending on the feedback if I'm going to keep going with this, because in 2 weeks' time, I want to tell you about the key functional muscle in the pelvic limb, the hind limb, and that's quadriceps femoris, and how different it is to the human quadriceps, its functionality. And if you drop down the menu, you can see these learning tracks. The next one is natural balance motion. So if you want to know a bit more about natural balance motion, do let me know. Click on the learning track. It's a really informative blog type discussion, a crowdcast from last year, and just kind of gives you some more information, and it's all free. And then the last one we've got on is health checks and first aid. So there's some really useful free tips on there, what to put in your first aid box. And that's tied in with our new YouTube channel. So please go and have a look at our YouTube channel, K9HS. And we're going to upload these webinars, these live webinars, onto the YouTube channel as well. So we're going to try and have them in multi-sources for you. The other thing that we've got going on, and a really exciting thing, we're upgrading our certificates. So if you would like a CPD certificate, we've upgraded our certificate system. It means it takes a little bit longer to get to you, but what's really exciting, you'll have your name printed on it, and it's an upgrade. So that should meet the needs of the different bodies you've got to pass it to, because I know a few people had a few issues with that. So that's only for 2020. You can't get them retrospectively, but all your CPD certificates but please be patient. All your CPD certificates coming through in 2020 take about a week to get to you, but they'll have your name printed on it as well. So I hope that meets your needs, and I hope you've enjoyed this evening. I really look forward to seeing you in 2 weeks' time at 7 o'clock. We're going to look at quadriceps femoris, and any feedback in the chat is great for us because it knows we're on track and it's what you're interested in. So bye for now. See you later.